I had a fair idea of what I wanted to do when I came in, having been involved in the governance of the state as commissioner, then as secretary of state government. The challenges were quite many, but what I tried to do was to compress them into three areas: the area of peace and security, the area of infrastructure development, and the area of human capital development. I also know that every government that will subsequently come after us, of course, has to work out strategies of dealing with those three areas, because there's those three areas interwoven forms governance of the state. So we use that three-point agenda, of course, to develop our vision of what we term the Delta Beyond Oil.
Dr. Uduaghan has been able to place Delta State on the world map through the construction of the airport at Asaba, the construction of the event center, and for me, I'll say the government house, the new government house. Delta State is 22 years old and we've been operating from a temporary government house. When the governor came in as a medical doctor, he has this yearning to help mother and child, because he believes that the infant and maternal mortality rates, should be reduced, and because of that, he started what he calls the free maternal and childcare program. Woman from conception to when she delivers, and also until that child is 5 years old, everything is free. He not only did that, he went ahead to build the infrastructure that will sustain this program that's been running for about 6 to 7 years now. And so you see the dedicated maternal and childcare center that is being constructed and completed by this administration. One is actually right in Central Hospital, Warri. It is a 100-bed hospital dedicated to mother and child. It's completed. And you also have another one at Ekman General Hospital. You also have a very old hospital we call Echo Baptist Government Baptist Hospital in Delta State. Hospital is over 65 years old. It was started by the Christian missionaries 65 years ago, and this administration took it over and did a total remodeling of Echo Baptist Hospital. So if you look at that, people's lives are touched, lives are saved. So it's one of the projects that is very dear to my heart. And like I always talk about the social sector, the education sector has received serious boost from the Uduaghan administration from 2007 till date. There has been massive rehabilitation of schools, massive construction of brand new schools, model primary schools that are so beautiful. You can compare them with anyone, anywhere in the world. You come into a place and you want to make sure you take it to a higher level from where you met it. And I want to believe Dr. Uduaghan has done that. In fact, some of the things he has done, people will not realize it now until maybe another 4, 5, 10 years from now. He's embarked on some mega projects that will impact our lives for so many, many years to come. Aside the Asaba International Airport, which everybody is enjoying today, not just the state, but all the surrounding states as well, in the south and in the southeast. So I believe that's one of the beautiful legacies that he's going to leave behind. And hopefully, I hope people will appreciate that and give glory to God, for what God has done in this state through this administration.
One of the cardinal principles of the Dr. Uduaghan administration is human capital development. And that is affected health, affected education, affected road construction. In other words, the human resource base of any society, of any community, of any nation is important to the other aspects of development. If you had roads, hospitals, excellent highways, what have you, and you didn't have the human capital to make use of them, to maintain them, then of course you'll have a major challenge. We are building schools to ensure that we prepare our children for the 21st century. The focus, therefore, is on human capital development. And education is cardinal to that. So when you get into secondary school, the state government pays for your fees in the West African School Certificate exam. Meanwhile, you don't pay for tuition. At primary school level, you don't pay kobo. There is a specific directive that no parent in our public schools should pay any money. So we're ensuring that the youth, the young persons in society, have the benefit of Western education. The concern of stakeholders that there are too many kids out of school. His Excellency the Governor felt that we should have a program that would ensure that these kids go to school. When they go to school, they should remain in school.
Education is very key to the development of a society. An uneducated society is a very backward society. So our strategy was get every child educated. Some could not afford it, so we also, of course, declared the free the free education for primary, secondary, and up to WAEC exam level. And we also noticed that there were some children who were out of school. Either they were in school before, they could not attend because of school fees, or did not even go to school at all. Could be as a result of the ignorance of their parents, carelessness, or economic hardship of the parents, who now took them to the street to sell, to be able to improve on the economy of the family economy. So we put up the Edu Marshal to go around the state as much as possible, although with the vast number of research, we could not really cover everywhere, and identify these children and take them back to the schools, to their schools, those that were not in school, should be enrolled in schools, and also counsel their parents, and that what they were doing was very wrong. So that was the reason behind the Edu Marshal program, which I know was quite successful, because many children were not taken back to school.
One of the greatest things that I've seen is this place coming back to beauty. It was almost dead when we arrived 9 years ago. And when the missionaries left in 2000, the place went into ruin. And we came back, many of the chiefs had asked us to come back, please save the place. That was in 2005. We came back, we tried hard, but we had to beg the governor for some help. He has brought this place back to beauty again. The roofs, the painting, all the structure has been changed. It is a glorious place now for these people to be helped, to be set free, to get healing, to get surgery, and we are so grateful to him. He has been a mighty friend to help Eku people, and we are so grateful.
There's history behind Eku Hospital. At the time, Eku Hospital was like #1 in Nigeria. In fact, families had this belief that if they took their ill ones to Eku Hospital and the person died, that the person was bound to die, you know, that God had destined that person should die. If the person died outside Eku Hospital, you say, oh, if this person had got to the Eku Hospital, the person would have lived. You know, that was the myth behind the Eku Hospital. A hospital that every Deltan is, if not just Deltan, most Nigerians got to know, and they associate with it. And of course, from the time it was constructed and was being used till now, a lot of things have changed in medical practice. A lot of technology has changed, a lot of equipment have changed. Of course, when I, looking at it, that hospital still has what I call the Midas touch in terms of healthcare. So all we did was to rehabilitate the place, re-equip it, motivate the staff, and again, they are really doing what they are known best in, and that is giving adequate health care to sick people.
There's a great improvement, unlike what it used to be before when the government has not taken over the place. And from the antenatal till delivery, the mothers, they appreciate a lot, because most of them, they will tell you, before they pay millions, we will do this, we will do that, but now everything is free.
In government hospital, they are really trying. They take better care of patients here than in private hospitals. Every morning they come, they take care of you, they take your vital signs, your urine, your BP, everything. They do it often here. Morning, sometimes 3 times daily. So I think giving birth in government hospital is very good than in private hospital.
I want to appreciate the effort of the governor by subsidizing for indigenes of Delta State. Otherwise, it's a thorn in the flesh to manage this type of disease. And as a result of the economic crunch, many people are just dying when they discover what they will go through and what they will pay. So the thing aggravates. So many of us, on behalf of others, I even said to myself today that I would like to appreciate the government because once you get one good turn deserves another. So if he has not come to our rescue, many would have passed away.
For this facility, for this privilege, some of us who has been to this illness that have tried a place like Edo State UBTH and later come here have seen difference, that the state government need appreciation from us.
We are the only one in this country, the only state, who has also subsidized dialysis. For you to go into dialysis in Nigeria, because whether we like it or not, renal failure, which is kidney failure, is becoming increasingly high in Nigeria. So this is the only state that has subsidized renal dialysis sessions from 15,000 per session to 5,000 per session. In which case, for every Deltan who has kidney problem and is going to the teaching hospital Ogara or Central Hospital Warri, instead of paying 15,000, in Lagos even it's about 25,000. Instead of paying that amount, you pay just 5,000. The remaining is subsidized by government. That is a legacy.
I want to thank the governor from the bottom of my heart. He has been a dear friend for the Eku people. I know when he came here, one time in his early years, his life was saved here at Eku Hospital. And that has made it a place of dearness to his heart. And we are so thankful to him, so thankful and grateful for all he has done to bring this place back to life again.
Today you see private persons building warehouses all over the place. And by the time the airport kick off fully as an international airport that is built for, the commercial activities in Asaba and the neighboring communities, especially on the eastern bloc, will greatly be improved. It's going to increase the commerce activity, commercial activity, and the commerce of Delta State and that of the neighboring states. Our very, very young and dynamic airport is adjudged one of the best in the country today. His Excellency the Governor is somebody I call the proverbial Nostradamus, the man who saw tomorrow. He doesn't just act. He doesn't start a policy without a backup.
The concept of the airport really, like I said, it's an international airport for economic development. Now, what, you do not complete the construction of an airport in one fell swoop. People must understand that. You do it in stages. We have done a stage now, and the current government is also doing the next stage. There were some challenges which the current government is dealing with. Now, the ultimate really is to receive international flight, is to have an area that has been reserved for preservation of vegetables, because it was supposed to be part of the chain of our agricultural strategy. So we're working with the federal government to develop that green area, for the airport. And I believe that if that is done, then what will happen is that farmers will bring their products to the place, and if the international side is ready, the runway is ready, and all that, farmers will bring their product. There will be a storage facility, and from there they can be flown away to other parts of the world. Well, I was going for Senate, and one of my friends and colleagues who has also been there was also going. But we're from two different ethnic groups. Shakiri Isijo. And of course, there were also other, what I'll call candidates that were not very visible. You know, the underground current and movement was becoming, was causing a build-up, you know, that would have caused big security challenge. And for me, my main agenda was peace and security. Now, it would be stupid of me to now be directly involved in an ambition, you know, and an ambition that will lead to breakdown of law and order. Like I told you, in 2003-2004 election, it was a result of the choice of a candidate that led to the massive destruction that took place in Delta, where villages were burnt, were sacked and all that. And I didn't want us to get to that situation. So I sat down with myself, and it was not supposed to be a do-or-die affair, and I will not be involved in a do-or-die affair. I will not be involved in an action that will lead to the death of one Nigerian, of one person. And I just said, okay, I had the as the governor, the responsibility was on me to take an action that will stop the kind of build-up that was going on, you know, on both sides, both ethnic groups. So I did. I took that action. Let me just put it this way. I've done my bit, you know, I've done what I was supposed to, what I could do in 8 years. I don't want to start thinking of, oh, what did I not do that I wish I had, that I wish that I ought to do. No, no, no. Somebody is dead now. He has drawn up his program. What I can do is to look at his program there from time to time, advise on. Because you see, there's no way one person can finish the job in either a country or a state or local government and all that. Things are always there. Things are there. Is it roads? Is it schools? Is it healthcare sector? Things are always there. So when you come with the available funds, you do the much you can, and the next person takes it off from there.